All right, we're going to begin with the coronavirus now as more Hoosiers are diagnosed with COVID-19 and admitted to hospitals. The Democratic candidate for governor insists that Indiana isn't doing enough to protect its citizens.
Yeah, ABC 21's Corinne Rose brings us the latest from the candidate, Dr. Woody Meyers, and the state's health commissioner, who defends Indiana's COVID containment tactics.
The hospital admissions in recent days are now as high as those seen in late May. This is all further evidence that moving us to stage 5 was wrong.
Dr. Woody Meyers is the Democrat running to unseat Governor Holcomb. As a physician and former state health commissioner, he's concerned the severe COVID-19 outbreak in southwest Indiana and continuing new cases elsewhere are making the state look bad. The city of Chicago is strongly advising residents not to travel here.
It's a big red flashing sign that says that there is a difference between what Illinois and Chicago are seeing going on in Indiana and what we believe to be the one going on in Indiana, and that Chicago is worried about us, Illinois is worried about us because they see our numbers going in the wrong direction and they want to protect themselves.
We have times when we have more hotspots, and other states have times like Illinois where they have more hotspots. So what we continue to focus on here as the state of Indiana is what we know works, and that is the ability to make sure that we are wearing masks, that we are social distancing, that we are doing the best hand hygiene.
Dr. Box agrees that Indiana's numbers continue to rise and says while non-COVID patients are taking up most of the state's ventilators and ICU beds, she's watching those numbers closely. And she says the state's COVID mapping is helping pinpoint problem areas.
We can localize those areas where we know we are having more cases, where we know we are having more hospitalizations, and to work individually with those particular counties or districts to make sure that we address with them those options available to them.
Dr. Meyers believes local health departments don't need options, they need better guidelines from the CDC and the state. Both doctors agree that an expected difficult flu season with unchecked COVID cases will strain Indiana's hospitals this fall. Corinne Rose, ABC 21.
Governor Holcomb, who did not appear with Dr. Box earlier in the day, but he did join her later in the afternoon on social media. Here's what he had to say.
You know, so many from all walks, different sectors have worked so long, so hard to get us to the position that we find ourselves in today. And if I could repeat, or if I heard you correctly, you mentioned that it could, you know, nothing intentional about it, but it doesn't matter what community or how small or large an event or the venue, could be a funeral, could be a wedding, could be a football game. And this is both anecdotal and through our tracing, we just see that the odds of this virus spreading go up when you let your guard down.
Well, we've reached out to the governor's campaign for the response to the specific points that Dr. Meyers brought up today. His office then issued us this statement, quote, "Woody is trying to scare Hoosiers, while Governor Holcomb is looking at the data and listening to the doctors to safely get Indiana's economy back on track. Woody Meyers wants to shut down Indiana's economy and arrest people for not wearing masks. We've made no such progress. We've made so much progress, rather, compared to other states. Together, we've made it to stage 5 because of Hoosiers' actions, and it's those same actions that will keep Hoosiers open, safe, and our economy open," unquote.